There is something fundamentally wrong with the American criminal justice system. That is a phrase we have heard more often in recent years from the media, political pundits, social activists, and policymakers alike. It has been uttered in reference to the issues that inequitably impact select individuals who deal firsthand with the overly punitive culture of the cops, courts, and various levels of the correctional apparatus. Even more frequent than the usage of that phrase, however, are the phenomena that allow it to resonate with all of us. Mass incarceration, over-policing, racial profiling, just to name a few. Today, however, I would like to focus on just one sector of our criminal justice system and discuss how a particular population of individuals within that system are suffering at the will of it. In further examination of incarceration overall in each nation, we find that approximately 25% of the world's total incarcerated population are Americans. So what this means is that America imprisons more of its own citizens than any other country in the world. Now, for those of us in the fields of criminology, sociology, public affairs, this isn't a surprising statistic. We're aware of this. But the factor that should be a red flag to all of us, regardless of our background academically, is how the system treats these individuals once they are, quote, on the inside. For the past 10 months, I have been fortunate enough to intern at the Urban Justice Center right here in New York City. UJC is somewhat of an umbrella nonprofit, being comprised of 11 different projects, each all with their own goals, mission statement, and funding. I was placed specifically within the Mental Health Project. Their main goal is to provide direct services such as legal aid and individual advocacy to low-income New Yorkers who suffer with some sort of mental health challenge. During my tenure with the Mental Health Project, I was able to focus entirely on currently incarcerated individuals with mental health challenges and their relationship with punitive correctional practices that they deal with firsthand, specifically the use of solitary confinement. I was able to do this because I was tasked with creating a report that would highlight current issues, the law as it stands, and any alternatives that might be able to remedy the situation. This is what I learned. The New York State Department of Corrections and Community Supervision, DOCS, as most people call it, they don't refer to solitary confinement as such. Instead, they have what they call special housing units, the SHU. Well, what is the SHU? Essentially, the SHU, if you could picture it, each unit within is a 6 by 9 foot concrete closet that you are locked into for 23 hours a day with guaranteed minimal social contact. From that description alone, one could gather that such conditions could be detrimental to somebody's mental health. Thankfully, in 2011, the New York State Legislature put into effect a previously passed bill known as the SHU Exclusion Law. The SHU Exclusion Law contains provisions establishing preventative measures so that those with a serious mental illness, as deemed by the Office of Mental Health, would not be put into SHU. They'd be diverted away from it. Also under the SHU Exclusion Law, anyone on the Office of Mental Health's caseload with any such designation cannot be placed into SHU, with one minor exception, which I will discuss in more detail in a few moments. Now, when these folks are getting diverted away from SHU, thankfully, they're being placed into an environment that requires a more therapeutic atmosphere, an environment in which they can get therapy, the help they need. There are a handful of these units, one of which being the Intermediate Care Program or residential mental health units. Unfortunately, the law has its loopholes. And for the past 6 years, New York State prisons have been taking advantage of them, in turn placing mentally ill inmates into SHU who should not be there. Now, we know, as I've stated, there are those who are in prison that are afflicted with a serious mental illness, but they're not properly represented on the Office of Mental Health's caseload. That's due to the issues with how that office diagnoses the folks that are in there. Over the past 6 years, the number of individuals who have been diagnosed with a serious mental illness has decreased by 36%. However, in that same period of time, the individuals coming into prison are being diagnosed with just general mental illness. And there's a difference here. This highlights a problem with how the Office of Mental Health is conducting diagnoses. Furthermore, individuals are being undercut in their diagnosis, in turn, not allowing them to have access to the treatment they deserve and the exclusion from more punitive environments that the law allows. The intermediate care program that I mentioned earlier, it's effective. In fact, it is probably the most therapeutic of all environments in any state prison, but out of approximately 50 facilities in the state, the ICP, the intermediate care program, exists only in 14 of these facilities, with an average of 55 beds per facility. An alternative to these ICPs are those residential mental health units I mentioned earlier. They're a welcome alternative to SHU, but the problem is they still operate in a very punitive manner. While in an RMHU, an individual can be disciplined and receive a disciplinary ticket just as anyone else in general population. Regardless of the reason, being disciplined typically results in the denial of out-of-cell programming, a punishment totally counterintuitive to the RMHU's existence. Furthermore, the punishment for receiving a disciplinary ticket translates into a longer SHU sentence added on to what an individual was already serving before they went into the RMHU. Now, to sum all that up, here's the big picture. There are people that are coming into prisons in this state with a mental health illness. The Office of Mental Health is misdiagnosing those who are seriously mentally ill, who then in turn, as a side effect, wind up in general population. While in general population, although they should have been diverted to a therapeutic program, they may exhibit self-harming or attention-seeking behaviors that correctional officers will perceive as being threatening or violent. Because of this, they're placed in solitary under exceptional circumstances, the clause which is the exception I mentioned at the beginning. Even more upsetting than the folks who are being prevented from getting care are those who never again get to see the light of day. Over 40% of all suicides in New York State prisons between the years of 2014 and 2015 took place in SHU. It's 40%. Overall, persons in isolated confinement of any kind commit suicide at a rate 5 times higher than those who are not in isolation. The system as it stands is messy, it's disorganized. In fact, it can be more harmful than helpful. The law needs to change. The law needs to change to provide better protections for these individuals. And that's where the Halt Act comes into play. What is the Halt Act? HALT is an acronym standing for Humane Alternatives to Long-Term Solitary Confinement. Its goal is to weaken how solitary confinement can be utilized in a prison. Now, it aims to do this by operationalizing 3 key concepts: creating alternatives, eliminating long-term solitary confinement usage, and then balancing the duration of usage. The bill proposes that any individual removed from the general population for longer than a 15-day period must be placed in a newly created residential rehabilitative unit, or an RRU. The model of this RRU is established so as to provide behavioral therapy as needed. 6 hours of out-of-cell programming, 1 hour of recreation. And this isn't a suggestion, this is a mandate. The Halt Act further proposes the elimination of long-term solitary confinement and seeks to do so by establishing that no individual can be held in isolated confinement for longer than a consecutive 15-day period or 20-day period in 60 days. Once this threshold is met, the individual must then be diverted to an RRU. The Halt Act isn't calling for the absolute elimination of the usage of confinement, but instead it simply aims to just make the usage of it more humane. Now, this would be achieved by allowing correctional staff to continue to confine an individual in extremely exceptional situations. And how would this work? 24 hours straight for an emergency situation, 3 days straight for an administrative violation, and then finally that 15-day maximum, which I've already mentioned. Additionally, the utilization of confinement can never be used when regarding individuals who are 21 years or younger, 55 years or older, have a physical, mental, or medical disability, are pregnant, or those who are perceived or who are identifying as LGBTQI. To close, it is important that you know that the very piece of legislation I've just laid out for you currently sits in the New York State Legislature right now, this month. Now, should the bill not succeed, countless individuals in prison who are dealing with these mental health challenges, who are not getting the treatment they need, and are being punished for having a mental health illness, they'll have to wait until 2018 for this bill to come back into cycle. Now, I was lucky enough to travel to Albany last week and meet with a handful of wonderful legislators who wanted to actually discuss the importance of this bill. Meanwhile, so that I can convey to them what this bill can mean for the future of a more humane correctional system. Our incarcerated friends, family, and loved ones depend on those who are willing to advocate on their behalf, because they cannot advocate for themselves. Hopefully, my continued work at UJC and beyond will result in just that, so that our elected officials might see firsthand the injustice our correctional system is perpetrating. Now, in order to get their attention, maybe we should come up with a slogan or redefine an already used phrase. Perhaps there is something fundamentally wrong with the way this state treats its mentally ill prisoners, and it must be addressed sooner rather than later. Thank you for your time.